All right. Welcome back to the, God damn it, Luke. All right, welcome back to Curiosity Corner, our weekly or monthly or however often we get this out to you guys. We are excited to be back here. And as you can see, Dr. Luke is not with us today, but we have our newest team member. This is Dr. Sarah Greenwell.
Hello, everyone.
Welcome to the Curiosity Corner, and welcome to RecoverRx. So, Sarah, if you can, just kind of give us your background, how long you've been with us, and what's it like being a PT?
Yep, I've been a PT for 10 years. I've started in a hospital system, great experience. I got to work with quite a variety of patients, and now I'm excited to join the RecoverRx team, where we focus kind of on that performance-based people who want to get moving, stay moving, and feel better doing it. So I'm excited.
Yeah, how long has it been now? How long have you been on?
So I've been with RecoverRx since about mid-January.
Mid-January, wow. It's like 3 months.
I know.
Holy cow.
Yeah.
All right, I got to put her on the spot now for this one. What is your most favorite aspect of working with your husband?
That I get home earlier at night. I like working with him, but I like that I get to see my kids more often.
Nice.
So I don't have my 6:15 patients or 8 p.m. patients anymore. So I get a little bit more kind of family time, but it's been fun. We work really well as a team. We have, since we were in school together, actually met at PT school.
Well,
so it's nothing new for us to work together on a project.
coming full circle
team.
now.
Yeah.
Yes. Sarah leading the way. So we're very excited to have Sarah on here. And recently she just created a blog, and it should be coming out soon. And it was an interesting topic, as you know, you said you've been working for 10 years.
Mm-hmm.
I got 9 years under my belt, and I think the theme of her blog was, how we talk to patients and what kind of obstacles sometimes we hear from patients, and how we overcome them through talking, listening, kind of improving people's mindset in terms of overcoming injury and things that we should or shouldn't do with the body. So I thought it was a really cool concept. You want to kind of talk a little bit more on stories that you may have heard from patients that may be barriers or limitations there to their kind of rehab potential.
Yeah, and actually even as a bigger overarching theme, so the blog is on kind of being told no, but both from maybe different physical therapists in the past or physicians, but the idea of what we say as healthcare providers can have a huge impact on our patients, on their whole life, not just on that one aspect that we're treating them for. So the idea of, as PTs, or I feel like, through our business and other companies I know, our mantra should be how. If you want to do something, how can we help you get there, instead of no. So I was telling Dr. David earlier, I had a patient not too long ago. She was an older woman, and she had a fear of falling, and part of that fear of falling was the inability to get back up if she did have a fall.
Yeah.
And
it's
so
scary.
I said, I practice this all the time with people. I said, let me get my yoga mat, we'll put some cushion down, we'll get the table so we can get some hand support. I'll show you the easiest way to get up and down. And as I did that, I went to kind of get in a half kneel position, and she stopped me right there, and she said, I can't kneel. I said, well, why not? Why can't you kneel? Well, I had a knee replacement. Well, okay, no scars, or how long ago was your knee replacement? 10 years. 10 years. So for 10 years, she said, my surgeon told me never to kneel again. Well, 10 years ago, that knee is well healed. It's not painful. She didn't say it was hurt to kneel on it. She just was told no. And the idea of being told no, I said, well, it's going to be less than 10 seconds. We're going to get down. Right. We're going to get back up. And, that refusal, that fear, and kind of, again, that fear mongering is not something we should be doing. We should find ways to kind of help educate our patients on, there's very little that you should never be able to do again. And, I agree that maybe you shouldn't be kneeling all the time, but,
right.
But to do a very daily common activity, getting up and down, for some people that can mean a ton. Right?
Well, think about how important it is for, like you kind of said, that's almost a snowball effect. I can never kneel again.
Yeah. So
what happens if I do fall?
Well,
how do you, it's like, how do you overcome that barrier?
And I actually read an article not too long ago about osteoarthritis, people who have knee surgery, and then how active are they after surgery. And it actually had an interesting insight into a lot of people aren't even that much more active after surgery than they are before. So again, we're creatures of habit, yes. Right? So as PTs who have patients before surgery, we get them moving, we want them moving, with the idea that you should be moving more after surgery, right? So my dad had a knee replacement, and one of the reasons is because he wants to get up and down from the ground with his grandkids, right, and build Legos, right? And so, yeah, he's not kneeling playing Legos, but he's getting up and down, and he's using that knee, and it feels a whole lot better. So
I think that's what's like a very important thing for us as a profession, and what we do here at RecoverRx and just in general for physical therapy is we really try to promote activity with our patients. And if we have a mental block or a stopping point or a barrier that says, hey, we can't do this, our job is to really focus on what we can do, right? So like even let's say for runners, I get this question all the time for runners, like, should I be running right now when my knee hurts, right? Well, let's be objective with it. Is running through the knee pain gonna make it worse? Maybe, maybe not. Does the benefit of you going for a 30-minute jog to clear your mind, to not think about anything, to get away from stress, and it makes you feel overall better, but your knee pain's a 1 or 2, I would say it's worth it, right?
Yeah.
And so it's kind of focusing on, like you said, the how, not the no.
Yeah.
Focusing on what you can do or what you can't do. And our job is to kind of provide that framework. So my conversation maybe with the runner is, take that green, yellow, red mentality, right? So green light means maybe your pain's like a 0, 1, or 2, or 3, right? You can run through, it's not stopping you, but it's there, you're actively receiving therapy for it. Yellow light may be like a 4 to 6 out of 10. Sometimes you go through that intersection, sometimes you pull back. You have to use your own thinking to kind of make that decision, and we can provide the framework for it. And maybe that red light it's a 7, 8, it's a stabbing pain, I should stop, and maybe I have to, right? And that's how it kind of factors into your rehab or your progression back to that activity.
Yeah.
Maybe that person that couldn't kneel, maybe they were worried it was going to be a 9 out of 10 pain and they were going to be a red light. But what if it was a 2?
Yeah.
Right? How much more powerful is it when you kind of promote their activity back to normal?
Definitely. And again, even one of the other things about, words being power, images can be power too. So unfortunately, our healthcare system, we've made it really easy to get x-rays, to get MRIs. And then when you get that feedback from the physician, what does it mean? Or you see your patient portal imaging results and it says you've got arthritis. So like you said, especially with a runner, somebody who's been really active, they come into the clinic and they say, oh, I can't run anymore because I got arthritis in my knee. Well, does your knee hurt? Well, not right now, but okay.
That arthritis may have been there 10 years ago, 5 years ago.
That arthritis is something that's gonna be there. And I think, I'm not a huge user of social media as much as maybe my kids will be someday. But one of the things I love is when I see those little positive videos, especially on like Facebook or whatever, and you see the 90-year-old marathoner, or you see the 7-year-old power lifter, and you think, these people have arthritis,
I'm sure they've probably been told to not lift that heavy or they're going to hurt themselves. Or...
I'm sure if you took an x-ray of every joint in their body at 90, you've got arthritis because it's just
100%.
Aging of the body, right? And we've learned that as a term that means fear and pain. But again, you can have an episode of pain that's related to arthritis, and then that episode of pain can go away, and even though the arthritis doesn't. But like David said, if you get out and you're moving and you're running, and it makes your body feel better, it helps you lose the weight, it reduces the stress, it makes you conscious of being healthy and active, and maybe you eat better because you feel better when you run if you ate better. How much of a snowball, like David said, does that really, for that long-term health?
Yeah, and that's why it's a very important topic. So I'd say going forward, if anyone else has any questions or concerns or wants us to kind of talk about anything else on Curiosity Corner, we like to put out blogs every month, and we like to put out Curiosity Corners about every month as well. So if anything has your mind or has your attention, let us know, and we'd be happy to kind of delve into that topic. So
awesome. And exactly, again, at RecoverRx, I was going to say, it's not this sign, it's on the other wall. That mantra of use every setback as a comeback. We believe that wholeheartedly, that
100%.
You can have an injury, you can have pain, but our tissues heal, and we want to get you back to whatever it is you want to do. And it might mean, baby steps, it might mean modifying it in the beginning, but there's very little that you shouldn't be able to do again.
Check out that blog and focus on the how,
not the no.
Not the no. Awesome. Thanks, guys.
Bye.